Welcome back, everyone, to the Deep Dive. And today we're diving headfirst into a topic that's probably on everyone's mind, especially if you're in behavioral health, electronic health records, or EHRs as we call them. But we're not just talking about the basics today. We're going deeper. We're going to explore those hidden costs, the ones that can really sneak up on you when your EHR system isn't truly optimized.
Yeah, it's like organizations, they invest in these systems hoping for a smooth ride. They're looking for efficiency. They want things to be streamlined and to be compliant. And then bam, they hit a wall. They run into all these unexpected challenges. And it's way more than just the initial price tag.
Right. You think you're getting this like silver bullet, streamlined documentation, better data, easier compliance, and then reality hits.
Exactly. And those hidden costs, they don't discriminate. They impact everyone from the clinicians to the program managers, the billing staff, and of course the clients themselves.
Yeah, let's talk about the clinicians for a second, because I think that's where the human cost of an unoptimized EHR becomes really clear. You've got these incredibly dedicated people who chose this field to help others, and they end up spending hours and hours wrestling with software. It's like the technology is working against them instead of with them.
It is. It really is. And that's what we call technological friction, and it's a huge factor in burnout. Imagine a clinician trying to do their job, but the interface is confusing. They're clicking through a million screens just to find basic information. It's frustrating, it takes forever, and it takes their focus away from what matters most, the patient.
And it's not just frustration either, right?
Yeah.
This can actually impact patient safety. If a clinician is struggling to document something important, like a med change, or they can't find a critical lab result because the system's so difficult to use that puts patients at risk.
Absolutely. And when clinicians are burned out and they're feeling overwhelmed, they're more likely to make mistakes. And in healthcare, even a small mistake can have serious consequences.
So you end up with this domino effect. Clinicians are staying late just to catch up on documentation. Program managers are building these crazy workarounds because the EHR isn't giving them the data they need. Quality managers are stressed trying to meet compliance requirements. It just creates this ripple effect of stress and inefficiency across the entire organization.
And in the long run, it leads to bigger problems. You see less job satisfaction, higher turnover, and then you're constantly having to recruit and train new staff, which ultimately impact the continuity of care that you can provide to clients.
And the irony is we invest in these systems to improve compliance. But a lot of times, if they're not optimized, they can actually create more compliance headaches.
Yeah.
We're talking documentation gaps, missing signatures, little things that can turn into big problems during an audit and lead to denied reimbursements.
And then there's the data itself. EHRs generate so much data, it's overwhelming. But without the right tools and processes in place, it's almost impossible to extract anything useful from it.
Yeah.
You've got state reporting requirements, grant funders asking for specific metrics, leadership teams needing up-to-the-minute data. It's a constant struggle.
It's like drowning in data, but starving for insights.
Yeah.
You've got all this information right there, but it's locked away in these systems that don't talk to each other. So you end up with program managers making decisions based on gut feelings instead of hard data, and billing staff spending hours trying to reconcile claims across different platforms. It's a recipe for inefficiency and frustration.
Exactly. And when you can't easily access and analyze your data, it's almost impossible to show the value of the work you're doing, to identify areas that need improvement, or to secure funding for new initiatives. It really holds an organization back.
So we've talked about some of the downsides, but there is a light at the end of the tunnel. There are ways to turn those hidden costs into opportunities for growth and improvement. And that's what we're going to explore in the next part of this deep dive. So stay tuned.
Looking forward to it.
All right, so we've spent some time in the trenches, looking at the dark side of EHRs, those hidden costs that can really weigh an organization down. But now let's shift gears a bit and talk about what happens when you bring those costs to light. You optimize your systems, and you start seeing your EHR as a tool for positive change.
Yeah, it's a real mindset shift. When you go from just putting up with your EHR to actively using it to its full potential, that's when you start to see real change.
So how do we make that happen? What would it look like if we could wave a magic wand and redesign an EHR system from the ground up, specifically for behavioral health? Where would we start?
Well, one of the biggest challenges in behavioral health is data fragmentation. You've got client information scattered across all these different systems. EHRs, billing platforms, state reporting databases. It's like trying to put together a puzzle with half the pieces missing.
And that makes it really difficult for clinicians to get a complete picture of their clients' needs, right? It's like they're only seeing a glimpse instead of the whole story.
Exactly. So in an ideal world, our EHR would prioritize data integration. Imagine a system that pulls in information from all those different sources and presents it in a way that's clear and cohesive that actually tells a story.
That would be a game changer. Clinicians could see a client's entire history, everything from their initial intake to their treatment progress, even social determinants of health, all in one place.
Right, and it's not just about convenience for clinicians. When they have access to that kind of comprehensive data, they're better equipped to identify risks and tailor treatment plans and make informed decisions that lead to better outcomes.
It also seems like that kind of integrated data would be incredibly valuable for program managers and leadership teams too. Instead of relying on gut feeling or outdated reports, they could actually see what's happening in real time, track program performance, make data-driven decisions about resources and strategy.
Absolutely. Data transparency empowers everyone to work smarter and more collaboratively. Another critical piece of our redesigned EHR would be a laser focus on user experience. We've talked about the frustration of technological friction, but it's worth repeating how damaging a clunky, user-unfriendly system can be to morale and productivity.
It's like asking someone to run a marathon in flip-flops. They might get there eventually, but it's going to be a painful journey.
Perfect analogy. We need to design systems that are intuitive and enjoyable to use. Clean interfaces, streamlined workflows, features that anticipate the needs of clinicians instead of getting in their way. When technology fades into the background, clinicians can focus on what matters most, connecting with their clients and providing compassionate care.
So instead of fighting the system, they feel supported by it. And that positive energy translates into better interactions with clients and a more fulfilling work experience.
Couldn't agree more.
And on that note, we'll wrap up this deep dive into the hidden costs of an unoptimized EHR. Thanks for joining us.
It's been a pleasure.
Until next time, keep asking those questions, keep exploring, and keep diving deep.